Dear colleagues, my name is Daniel Helbling from the Oncocentrum here in Zurich, and I'd like to present a study which was presented at ASCO 2018 just some weeks ago. It is the Valentino study. The Valentino study treated metastatic colorectal cancer patients in the first line with either FOLFOX panitumumab continued with 5-FU panitumumab or FOLFOX panitumumab continued only with panitumumab. So the experimental arm had a continuation therapy which was done only with panitumumab compared to panitumumab 5-FU. It was a randomized phase 2 trial. It was a non-inferiority design, which is a little bit special for this situation, and it tried to show that you can safely continue with panitumumab alone instead of 5-FU panitumumab. Unfortunately, the trial did not show this. It was not non-inferior. In other words, it was not so good to continue with panitumumab compared to panitumumab 5-FU. The PFS was different. It was only 10 months if you continue with panitumumab alone compared to 13 months. You see that on this graph here. And also the toxicity was not markedly reduced by just continuing with panitumumab. So one can conclude that it is probably safer to continue with 5-FU panitumumab if you want to continue with something. Now, this trial raises loads of questions. It raises the questions: how do you continue after 8 cycles or after 2 months, or after 4 months of induction chemotherapy? How do you continue? Do you continue or do you make a break or not? It's also, for me, quite complicated to put this trial into perspective with other trials. So there have been many trials with continuation therapies, the Optimox trials, there were the COIN-B, there were the MACRO-2 trial, loads of different schemes, everything a little bit different, not so easy to make a take out of all this. So my primary question to you is, how do you now interpret these data from the Valentino study? Do you come to the same conclusion that you continue with 5-FU panitumumab? Or do you say no, the difference is rather small anyhow, and if one can reduce a little bit of toxicity by just continuing with panitumumab instead of panitumumab 5-FU, this is still worthwhile? So that's my first question to you. And my second question to you is, how do you anyhow solve this problem in clinical practice? Do you continue with the therapy? Do you continue as in the trial until progression or toxicity? How do you do that? Do you just go for 8 cycles like they did for 4 months and then you make a break? Do you just say, you know, basically I base this on my patient, on the patient wishes? But you need to have a scheme. So what's your scheme? Do you generally say a continuation therapy is preferable to a non-continuation therapy? So that's my prime questions. Thank you very much.